Thank you for joining us today. My name is James Finnegan, CEO and founder of Inspiring Physicians Worldwide. And what you're witnessing is my procedure actually being performed. Many people had asked multiple times, hey, have you had this treatment done? I'm excited to report that I absolutely have, and also excited to show you what's happened in just a short amount of time during this procedure. So jumping right into the procedure side itself, this is not intended to be for training purposes whatsoever. This is really just an opportunity for you to see firsthand some of the things that happened during the case, why we're doing some of the things that we're doing and so forth. And really just to jump right into it, as you notice, this is after the consent forms have been signed, and this is the interaction between the physician and the patient. So this is actually Dr. Sierra DeAragon out of Chandler, Arizona. And she's actually just communicating back and forth with me as the patient as to what areas interest me the most. And it's important during this phase to really isolate what the patient wants the most and have a good time. And obviously, this is awake body contouring. This is not fully sedated. In fact, this is oftentimes providers will give a couple milligrams of Ativan just to reduce anxiety and to make you a little bit sleepy. And then maybe even 5 milligrams of oxycodone and Zofran to help with any nausea associated with the opiates. But for me in this particular procedure, I had 2 milligrams of Ativan and 5 milligrams of oxycodone. And you'll see during the procedure, the goal is to make the patient completely alert, make sure they're able to respond fairly easily during the procedure. And it's exciting because we're going back and forth right now and discussing how that would look with that etching. She's following the natural anatomy in the body, palpating the muscles, and moving right up and down from the love handles all the way to the gynecomastia, trying to reduce the mass in the breasts and the nature there as well. So this part will typically take anywhere between 15 to 20 minutes, just going through with the patient to make sure that they're getting exactly, we're getting exactly what the patient wants, or areas that ultimately we want to focus on for the best aesthetic benefit. And so you can notice, even though she's marking lateral to the breast and the gynecomastia side, as fat can accumulate near the axilla area. Now, going right into standardized photo documentation, this is really important. It's important to do pictures before you mark without any of the markings, and then after you've marked as well, because it shows that you've actually created a treatment plan with the patient. It's a great way of actually showing the patient, okay, we focused on these areas before, and we really, really enjoy going side by side and showing what the before and after photos are, especially if patients may feel that an area in the back was done that wasn't circled. It's kind of important to make sure you have that documentation to help show them as a proof source exactly how that is and how it works out. So going right through this, each one of the positions, so you should actually have a tape or marker on the ground so that the distance between the camera is exactly the same each time, whether you're doing your before or afters. It's really critical that you have the same lighting in the room. So I try to encourage each one of our physicians not to use multiple areas in different areas, although you can see that screen is a screen that can be purchased online and can be used in each one of the rooms. This is an actual room that is kind of dedicated to consultations as well as documentation for photos of before and afters and so forth. And it's really easy. So the camera's about 3.5 feet away from the patient, and the patient is looking down. So the patient's actually moving in 1/8 increments each time, or about 45 degrees with each position. And it really kind of gives you a good indication. So arms out. The most important part isn't that arms are out or arms are in. The most important part is that you're doing it the same sequence each time, and so that you can refer to those. So this is an aseptic dermatological procedure. As you can see, this is in a clean room. The Mayo stand there is sterile, obviously. So the physician was putting on sterile gloves. And this is kind of important. A lot of people ask, well, I don't understand it. This just seems like it's in a regular treatment room. That is in fact true. This is a standard 8x8 treatment room. It's important to have a couple inches between the wall and the sterile Mayo stand so nothing sterile touches it, any of the sterile instruments. But you can see, the physician's putting on the infiltration cannula, and that's the cannula that vibrates, that puts the infiltration fluid in. And so you'll see there's a little silver clip at the bottom of the handpiece, and that's used to hold the infiltration tubing so it doesn't drop on the ground even if you take the infiltration cannula off. And now, the whole patient will be HIPAA cleansed and completely cleaned prior to us doing any of the procedures. So that's kind of an important step. But what you'll notice here is we're purging the tumescent solution. So what's included in the tumescent solution is obviously saline. You can use it with lactated ringers or without. If you use lactated ringers due to the potassium, you don't need sodium bicarbonate to buffer the pH balance of the lidocaine. In this particular tumescent solution, it was regular saline, and so the physician completely purged any air bubbles out of the tumescent solution. So there's lidocaine, epinephrine, and sodium bicarbonate typically. So we subscribe to the Jeffrey Klein tumescent solution, which is 35 milligrams per kilogram, no more than that, and it can go on up as high as 55 milligrams per kilogram. But we tend to stay at the lower dosage, and that is really important because the vibration distracts any painful stimuli to the brain. So that you can see the assistant is kind of helpful in this to have, just to help make sure you're HIPAA cleansing the whole entire area. And you'll notice that this provider right here actually, at one point in time, actually HIPAA cleanses the whole arm and hand. And the reason for this is if the patient were to accidentally move their hand up and touch any part of the abdomen, it's kind of helpful to not have to completely HIPAA cleanse that area to get it sterile once again. And so she's doing that just as a measure to protect that environment. And so going right through this again, you'll notice she's draping with sterile drapes on the top and on the bottom, and there's a real purpose for that. If the cannula bumps into a non-sterile field, you introduce bacteria into the operative field. So although this is an aseptic dermatological procedure, the area that we're treating is an actual sterile field. So it's important to kind of respect that area and make sure that nothing is touching that area or could ever touch the cannula that would be actually non-sterile. And although lidocaine is bacteriostatic, so you see the incidence of infection 0.001 with body contouring and sculpting, it's important to really be mindful of those things. So, the assistant there is really to help circulate, to operate the equipment, and you'll see even the doctor will use the blue sterile towels even to help drape around the arm if they feel that. So Here's an interesting technique. So just in the added sites where we're actually making our punch biopsy sites, the doctor will draw up from the tumescent solution that we used and we purged into a little stainless steel container. She'll draw up an additional 50% just straight lidocaine and put it right into that solution. So it increases the amount of lidocaine that goes right towards the incision sites. This just helps as the vibration is moving back and forth. And notice how much easier it is for the physician. You should be able to see a nice whitening effect due to the epinephrine getting great vasoconstriction on this procedure. So this is a 30 gauge needle. When we're using the camera on a close-up, it looks like it may be in 27 or 18 gauge. It's just a 30 gauge needle. So roughly about the size of an acupuncture needle, and you want to raise a very large bleb. This allows us, when we're doing our punch biopsy sites, to be able to really get a nice anesthetic effect, so there's no discomfort from the patient, and that's really important there. So that big bleb should look like a very, very large TB test bleb, and that's kind of important. So you'll notice on this particular procedure, we are doing high definition sculpting. So you're going to see probably 8 to 12 little incision points on both sides. Where we are looking for a lot of drainage, we're going to use a 3mm punch biopsy site, and where we're just looking for an entrance point, we're going to use an 11 blade scalpel. And so those are kind of important things to notice, that the difference of why we're using a punch versus a scalpel. Obviously the punch stays open for about 24 to 72 hours, and that really helps with all the excess draining for the first 72 hours. With this particular procedure, it is not advised to suture or to steri-strip that punch biopsy, or otherwise the accumulation of fluid can persist for well over 90 days or up to 90 days, and it can create a lot of discomfort for the patient. So we actually want to encourage drainage, and that's why the 3mm punch biopsy sites are encouraged. So you'll see there's live monitoring And what are we monitoring here? Blood pressure every 30 minutes, active saturation, and blood pressure. We want to see what the sats are and how well that patient's satting, so we know that they're not they don't have apnea and they're able to breathe and they're not in a lot of pain where their heart rate's racing. So we're looking at that as active monitoring in the patient and their comfort level. So you can see the assistants trying to make sure that the cords are positioned so they don't get hung up. This is actually a 2.5 millimeter infiltration cannula. And you'll notice as the physician we're talking back and forth, answering questions, moving forward. Some physicians allow their patients to Snapchat or to watch Netflix or even put headphones on. It's entirely up to the provider. But notice on the infiltration, the first step is going right below and above above the scarpus fascia and really moving slow at the base of those nerves. This is an important step because as you're moving around nice and slow, you're knocking out the large nerve bundles that move up to the sensory nerves towards the dermis. And so you'll notice the physician's moving fairly slow, and the infiltration fluid, we're moving it at probably 200 to 300 milliliters per minute. And so you want to keep moving and fanning. So notice how she's moving the infiltration cannula almost all the way out towards the added site and finding a new pathway. So this vibration really does create a nice oscillation at the tip of the cannula. And you can notice my left hand there, I'm actually texting right now, and it's absolutely comfortable. Most of the time, this is the most uncomfortable part of the procedure. But what I can tell you that I'm experiencing at that time is it just feels like a little bit of pressure. There's no sharp pain, there's no discomfort whatsoever, and the physician then will move a little bit quicker once she gets to be more superficial. The thing that you'll notice there, you see the white blanching at the incision site. That's a 3 millimeter punch biopsy site. You obviously want one in the suprapubic area so that as the drainage and the gravity feed of the fluid comes out, notice her speed instantly started to step up. She was able to hit the biggest trunk nerves and now is able to move superficially. And it's great because when you're that comfortable and you're able to text, and even a lot of providers will allow people to chat on the phone while they're having their treatment done. And Snapchat has been a lot of fun. We've noticed a lot of our patients and providers are using Snapchat as a great medium to help people understand, and that's just showing the tumescent solution is flowing very consistently. But the most important aspect of all of this is the patient is comfortable and they're moving right along. So this goes all hand in hand to the patient's experience. Now, typically, as we all know, men typically have the lowest pain threshold, and I can personally attest to that. Once I had this procedure done, most of my friends said, hey, if you can do this, I can do it as well. And that's an exciting part of it because the biggest discomfort associated with is a little pinch here and there that is really not uncomfortable for most of us. It just feels a little bit of an agitation. But as she's moving along, once again, moving a little slower to get started, and we'll move much more quickly as she moves along. So the full area, so this is step one in the whole procedure, is to numb the area with the tumescent solution, which is the local anesthetic. So the patient's vitals should be high. They're breathing, they're talking. You can even say, hey, do you want to take a nap? The fun part is you really get to know the patient very well as a provider while you're doing a treatment like this, and they get to know and trust you and the office staff. So I typically encourage our providers to ask the patient if they're not going to have headphones on and so forth, or they're not going to watch a video, if they would like music piped into the room. And we'll actually take that music, pipe it into the room, and it's a big benefit because the patient feels like they're being tailored to. And that's kind of a fun part as well, to get to know what the patient's music preferences are as well. So moving along in the ribs, this is one of the most sensitive areas. And most of our providers really try to do that as quickly as possible to get right above that rib cage there. There's a lot of nerves in that region, and it can be really tender. But if you do that area first and you really infiltrate that area first, it really gives it enough time to set up so the sensory nerves are also really quiet when we're going through that area, and it's very comfortable for the patient. So moving along, so you'll see a great distension. You're actually really trying to get a very true tumescent of that area, and you want to see a nice distension like that. If you put most of your solution in the deeper part of the subcutaneous tissue, you won't get a very good aesthetic benefit because you're just taking away the deep fat around the scarpus fascia, and that medium to deep fat packet. You want to actually go deep, then actually in the middle of that zone and the superficial zone. So there are really three major deep areas that we're going to be focusing on. So you notice she's covering the right to left side. I'm pretty relaxed. I don't know if you can see what my headset's in. And I actually do end up taking calls during the procedure as well. So you do feel a little bit twilighty, but perfectly able to respond and so forth based off of whatever commands the physician asks you to do. So it's important, that during the procedure you can ask questions. You can say, hey, what do you think of this? And even at the end of the procedure, it's a great opportunity to stand up, look at the area, and if there's any other areas of concern, you can do more. So the physician, occasionally will say, how's everything going? And I'm saying, I feel great. I don't feel anything. It just feels like pressure. And that's the most common statement patients make once the lidocaine's in there. They just feel like the skin is heavy, and they feel like it's, that it's, that it's numb, but it's a heavy sensation, not of any pain or discomfort, but it definitely feels numb in that region. So moving into the breast area, obviously doing the full tumescent. So the benefit of this obviously is we're getting full coverage, and she's numbing all of it. And what this does is it actually suspends the globules of fat. So when the next cannula goes underneath the tissue, the aspiration cannula, it allows the fat to gently be aspirated away with very, very little damage to blood vessels and supporting structures such as the nerve endings, the fascia, and those structures that are so vitally critical to getting that skin retraction. But as she's moving along, she's being very careful around the axilla area and just causing it to really to mess well. So this infiltration can take anywhere between 15 to 20 minutes, depending upon the physician. But you want to see a nice blanching in the overall effect of any area that you want to do. Now, sometimes people will ask a question, what's the real purpose of marking? There's multiple reasons for marking. One of the main reasons is when a patient stands up, the anatomy looks quite a bit different, and when they lay down, the gravity changes the perception of fat pockets, areas of concern. So we want to highlight those areas. We want to highlight the anatomy and the muscles and following the muscles. Those are important steps on it, but one of the key reasons behind marking is also to make sure that when we tumesce, we're tumessing around all the areas of interest for the patient, and it keeps us from going outside of our line. So the line of demarcation should be pretty clear from the blanching to the normal skin tone, and we don't want to go outside of that realm. If we go outside of that realm, that can be fairly uncomfortable for the patient, and we certainly don't want to do that. So that's one of the main reasons we mark that. Now, we are limited on the number of areas that we can treat based off of about 5 liters of tumescent solution going in, and then 5 liters of total fluid coming out. So that could be supernatant fat or infranatant fluid, but the total volume coming out is 5 liters total volume. So we're putting 5 liters in and 5 liters out, and that's the maximum. So a lot of our patients will only have 2 liters of fluid going in and about a liter or 2 coming out in fat. But when someone has a large abdomen, obviously you're going to take out more, and so you have more ability to take out a little bit more and do sculpting. But the 5 liters has been the national standard for that cutoff, and there are some states that have even less guidelines. They would allow less to be taken out, but it's based off the individual state and what those regulations are. But nationally, the standard has pretty well been accepted that 5 liters is the safest for an in-office procedure such as this. So you notice there's no IV or general sedation here. This is all just oral sedatives such as Ativan and oxycodone 5 milligrams. So you can see here the doctor actually has another physician coming in just explaining how the procedure works, a little bit of training, a little bit of helping him to see, look, this is straight yellow coming out. Oftentimes physicians will say, I'm not sure, why are we getting just such straight yellow? I've watched Nip and Tuck and all these other different programs, Dr. 90210, and there's a lot of blood associated with it. With the older technologies that a lot of physicians have, and it's called traditional lipo, those devices just go in and damage the supporting structures. They're really not seeking after fat, which is really in the path of least resistance for this vibration in science and how well it really spares those connective tissues and so forth. So, oftentimes people say, wow, this is incredible. So with this device, it's very efficient. Obviously, we can do about 1 liter every 10 minutes. And that helps decrease the fatigue of the physician and allows them to really focus on the results. So there's a lot of therapies out there, and many of you know Cool Sculpting and all of the other non-invasive therapies. And they tend to work better on patients with very, very low BMIs, like 26 or what have you, or below. For a patient such as me with my BMI being much higher, I wouldn't be a good candidate for those non-invasive treatments. And 80 to 90% of all patients in the U.S. want more sculpting. They actually want to be able to see the results. So you're going to see in this video, as we go along, you're going to get a chance to see the actual before and after. As you look to the beginning of the video and the after, you'll see there's no comparison, and it really is an objective result. You can truly see the before and after. So there's very little fluid, mostly fat. I don't know if you can see that canister with this particular shot, but there's probably 10% fluid and 90% just straight yellow fat, and the canister fills up very quickly. So for our physicians that sit there and they work for an hour to get 1 liter of fat, they're not using that science and vibration. So there's 2 different waves of vibration with this particular modality, 3200 and 4200. If it's more fibrous, you'll use a higher vibration setting for those 2 adjustable amplitudes. But it's amazing at how science has finally come forward and advanced in these treatments. Now you'll notice the doctor is still moving it at about 2 revolutions per second. It doesn't change the actual overall movement, but the trauma is changed significantly because it's just gently moving through. So that handpiece is moving, let's say, at 32 revolutions per minute, and the physician's holding it kind of like the bow of a violin, moving it back and forth, and it's exciting. So you can notice the MA is watching the vitals, just turning on the machine on and off, so she's operating the pedals. And in this shot, you can start to see the abdomen is debulking right there in front of the camera. So it's great, and you don't do any of the abdominal etching until the end of the procedure. So you do all your debulking first, and you want to leave less than 2 centimeters of fat left all over the abdomen. And that's kind of an important aspect of it. So, we talked about the 2 strokes per second. There's going to be areas that are more sensitive where you might slow it down. But if you really look at the timing, and we're utilizing the same camera, going back and forth, you'll notice that literally within about 20 minutes, the physician has 2 full canisters of fat. So she's moving at a very quick pace. You'll notice behind the physician, the MA is actually, snacking on some fruit snacks or what have you, and it really is more of a comfortable procedure, although that's not completely OSHA compliant. It's a comfortable environment, and you'll notice even in these types of environments, if the patient says, hey, I'm thirsty, you want to give them a Capri Sun or something that gets their blood sugars up a little bit. This is not a procedure where we want the patient not to have eaten before they come in. We want them to actually eat breakfast or lunch before they have their treatment, because it helps to metabolize the drugs that we actually give orally. And you'll notice she's moving along at a pretty rapid rate and continues to move that. And that's a 3 millimeter Mercedes cannula that she has on there for aspiration, and moving right above the ribs, which can be fairly sensitive. And you can see the setting on the machines around 3,300 revolutions per minute. You can move as high as 4,200 during the whole case, or even on up to 5,000 if it's very fibrous. So people that have had liposuction done before with very uneven methods, this procedure goes in and it really does shoulder and settle those areas down. I've never had any body contouring procedures performed in the past, so the machine will move right through, and you'll hear physicians say it feels like just butter moving right through the tissue, because there is no resistance in scar tissue created by other procedures, whether it's been traditional lipo or ultrasonic assisted lipo or even laser assisted lipo, which can create a lot of that. So continuing to look through, and you'll see, the circulator there, really her whole job is to get canisters ready, keep replacing them as needed. And she's obviously measuring fluids as well, so her purpose is to watch vitals, and help the physician in any way. Now this actual room is an 8x10 treatment room, and it's more than sufficient for this particular treatment, and the physician keeps cross-hatching. So what you're noticing, she's fanning it. It may not look on the video that she's moving it, but it's actually moving 5 millimeters with each movement, and she's roughly doing about 30 fan movements at 5 millimeters each, completely fanning and cross-hatching that area. So the ultimate goal is to cross-hatch underneath the skin, coming from multiple incision sites, so it really does look like a tic-tac-toe pattern under the skin. And when you're putting your non-dominant hand down on the skin, you can feel it debulking. So it's really, really rewarding for the physician, and obviously for the patient as they get done with an hour to an hour and a half treatment. It's pretty exciting to stand up and really see that dynamic difference. So she's got great movement, great efficiency, allowing that effect with the vibration to really help her in guiding the tip of the cannula through those tissues. And there is no brunt force to the patient. This is just nice and easy as it's aspirating, and that tube is completely full. Doing an excellent job. You can see the canisters continuing to fill fairly quickly. Once again, a liter in about every 10 minutes at this rate. And you can drastically slow down the efficiency of the system if you want to slow down the strokes that you're doing. But most physicians, in order to do 2 or 3 cases a day, they move at this high accelerated rate to get the most efficiency. And the quicker you move the handpiece, the more efficient the actual vibration is, and how it really, really does allow you to just aspirate the fat cells nice and efficiently and easily. And it really does limit trauma. So if a physician decides to move real slow and to go back and forth, they're going to notice a higher percentage of dark purple or dark red, which is blood obviously coming into the canister, versus moving it along and getting a light pink to a really liquidy effect. And you can see that most of that is fat moving through. And there is quite a bit of tumescent solution on the left one with a tinge of blood, but continuing to move across. So there's 2 effects that are happening here. As we're sparing the connective tissue, those fascia bands that are there, and the nerve endings and so forth, you're getting when we wear a compression garment for 2 weeks both day and night, we're getting a great skin retraction. But also, as that cannula is disrupting those 350 microvessels or microvasculature bed, it does cause a cytokine to be released in the surrounding tissue. So the fibroblasts are actually stimulated to produce new collagen and new elastin fibers. So we're getting a really 2-form an effect of benefits of tightening and moving right along into the tissue. And you can see we're getting ready almost to start doing the abdominal etching. And the physician continues to just see little areas that aren't as responsive. You can see the gynecomastia, the breast tissues come down considerably. And just watching the procedure, I can tell you, the one thing for me is I just wanted to sleep during the whole treatment. And there's an area where you just want to sleep, and part of that's because as you're moving along in the procedure, there is music in the background and it's very comfortable. And a lot of times, it is okay to have a patient sleeping as long as their vitals are high and they don't have sleep apnea or anything like that. And you can move right along in the case and just enjoy it. And some physicians say, hey, I love it when my patients sleep. And so they encourage them to watch Netflix or something else in order to just really get them more comfortable. Obviously, in this case, as CEO and founder of the company, I wanted to be able to be as alert as possible to tell people what my true experience was and the excitement that goes behind having a treatment done like this. So obviously you can have, a lot of different types of treatments done. The one main question I think both men and women ask is, what is the healing time like? And it's kind of important because in order to get the fat to come out in a very smooth way like you've seen on this video, it's important to put all that numbing medicine in. You'll see the physician using the 11 blade to go in and do the the entry ports for the fat transfer, and due to the high zoom on the camera, it obviously looks like a much larger blade than that. But this is just an 11 blade going in, and you'll see the full abdominal etching that happens as a result of that. So on each one of those entry points, so when you're following the muscles in the abdomen, it's important to make those individual ports. You can see fluid coming right out of that. There still is a lot of local tumescent in there. We want to make sure that as we're going through, that each one of those lines of where we're going to do abdominal etching has a scalpel point of entry point, and that's a way of keeping it so that it's really in line with the body, and that we're able to really do some withdrawal. So you can see the skin is more lax because there's no more scaffolding there, and you know, it's really interesting as you're feeling that, and you can see how much more flat your stomach is compared to when you started. But it's most instantly gratifying, and I think most of us today, whether you talk about playing sports growing up, your body and metabolism is a little bit higher, or just in general, and as you get older, it's a little bit harder to lose fat in other areas that you're working to try and beat the clock on. So they're cleansing the entire area. And now they're moving and just trying to manually express any additional fluid that might be in that area. So you can see each one of those little tiny 11 blade sites. You can kind of get a good feel for that. But the reason we manually express the fluid out is it's naturally going to drain out with a compression garment over the next 24 to 48 hours, and you just change pads that go hand in hand there. But you'll notice if you can manually express any existing fluid that it shortens that process for the patient. So our goal is to have patients after this procedure go home and rest for about 3 to 4 hours. After 3 to 4 hours of sleeping, hopefully, then we go right into having them shower. So look at the abdominal etching here, and you can see the difference. The fluid that's coming out there, yes, there's a little bit of blood, but look at the complete difference in the breast tissue as well as the side profile. Completely a fun procedure to have done. Excited, when you look at yourself in the mirror and all of a sudden you instantly see your body shape has completely changed. It's incredibly rewarding. And I know the physicians, when they do this procedure, they get excited because they get to see right then and there what the procedure's like. So you can see here, these are actual, sterile pads that are used because they're highly absorbent. So they have polymers in it, and they're they have a higher absorption than any absorbent medical pads. So these are just sterile feminine pads that are used, and you put that on the patient, and you can either use an abdominal binder or a full abdominal compression garment with abdominal binders. You'll notice on this, we were going for bimodal compression, and so you'll see a black compression garment that we're putting on. It almost looks like a tutu. And then you'll see a full abdominal binder that goes around the abdomen. The thing that I really do like about this process is you are wearing the garment both day and night for 2 weeks for the first 2 weeks. And then week 3 and 4, you're wearing the garment just during the day. So at night, you're taking it off to allow that circulation. Now, obviously, after that 3 or 4 hours of resting, we do want patients to get up, maybe go for a walk for about a half a mile to a mile. There's a couple purposes. The number one purpose is to get the lymphatic drainage system up and moving, to help the body to get rid of any excess fluid, but also the gravity feed that happens as just moving around causes a lot of these pads to fill up with fluid, and you'll actually end up changing those pads 2 or 3 times in the first 24 hours. But it's exciting because the results are instant. You can tell your clothes fit differently, and many people will say, well, what did you do the next day? The next day, I got up, changed the bandages, the pads, super simple to do, and I was out driving around in my car that was a stick shift and had no trouble shifting or what have you. But the true effect is you get a chance to see how well the skin looks. You feel better in your clothes, so your confidence goes up. You feel like you have more energy, and that's kind of an important part of it. But also, when you do go to move, you could be sitting there watching TV, and when you go to move, you sit up and it feels like you did about 1,000 crunches. That's about as much of a discomfort. It's just like if you've worked out hard and you've strained the muscles that are trying to rebuild. That's what it feels like for about the first 3 to 5 days. So that's the first compression garment. And typically those work well for the first few days. And then the body, all of that fluid completely drains out, the remaining fluid that's left. And it looks even better, of course. And then you pretty much take that garment off and just wear the abdominal binder. So you see a lot of our providers just using the abdominal binder, and I think that's more than sufficient as well, because you can continue to tighten it up and continue to tighten it up as the skin continues to shrink. And now the skin is a little bit saggy because, you know, you've taken all that fat away, that scaffolding away, and now as the skin readheres to the path of least resistance, it starts to really tighten up, and it's pretty amazing. So this actually has Velcro on one end, and so you can come from one end and really tighten it up and have someone help you to continue to retighten it. So at this point, you want to make sure that it's tight enough where if you put 2 fingers down in the area, it snaps back. And if you just go back on the video, if you want to see the before and after photos and toggle back and forth, because this is one complete video, you can see the gynecomastia is gone, completely flat. And that's really awesome to have these types of treatments that can really allow this. So if you look through these, this is just the fat and a little bit of the fluid that's left over with a total volume of 5 liters. So thank you so much for listening and appreciate your time. And we look forward to answering any of your questions that you may have about FunSculpting and the high definition lipo product with Inspiring Physicians.